So many people across the country are dying from opioid overdoses that organ donations are actually at a record high.
Drug overdoses are now one of the leading causes of death in organ donors, especially among young people.
WSLS 10's Rachel Lucas went to the United Network for Organ Sharing headquarters in Richmond and found in the past decade alone, organ donors who have died from drug overdoses have increased by 500%.
Here in Richmond at the headquarters of UNOS, death is simply a part of living. Through the work done here, from tragedy also comes the gift of life.
This is a blessing for them, but clearly it comes as the result of a tragedy for somebody else.
The tragic killer that's now claiming more lives than ever before is overdosing, especially on opioids.
I think it's something that surprises a lot of people. Because clearly people think of organ donation and typically they think of traumatic accidents, but now drug overdose is a big part of the organ donation process.
According to data collected from UNOS, here in Virginia, overdosing is ranked as the third most prominent cause of death among organ donors. This year alone, they make up 12.8% of causes of death among donors. That number has increased dramatically over the past decade.
In terms of causes of death for organ donation, it's now larger than automobile accidents.
A statistic that Dr. Klassen, the chief medical officer at UNOS, says is unprecedented growth.
It's a 500% increase compared to 10 years ago.
500%, that's huge.
It's huge.
A trend they really started to notice 4 years ago. Klassen said it started in New England, spread through Appalachia, then to the upper Midwest, now claiming the lives of those all across the country. Just outside UNOS is a National Donor Memorial lined with yellow roses, the official flower of a donor. Putting a face to that statistic, here we are reminded that those numbers are people, family, friends. These names engraved on the wall represent the thousands who, in death, allow someone else to live. It puts a changed perspective on donation.
And here in the memorial, this is what's known as the grove. For every drop that comes from this fountain, that's meant to represent the life-saving gift of organ donation. And we now know that more young people are giving their organs, not because of a traumatic incident, but because they essentially are taking their own lives due to accidental overdoses.
I think anytime there's almost a bittersweet that goes with organ donation.
Well, that's actually true under all circumstances, but I think it's especially, notable under the situation of an overdose death of a young person.
Because of the opioid crisis, it's the first time in recorded history that there's a surplus of young organ donors. Despite overdosing, Klassen says their organs are still quite viable.
A lot of people don't understand that people dying of overdoses can become donors. And in fact, they are very good and appropriate donors in many respects. They tend to be younger, and they tend actually not to have a lot of other illnesses associated with them, such as diabetes or heart disease, because they are a younger group of people as a general rule.
I think that's interesting. There's a stigma that follows addiction in life and in death.
Yeah, unfortunately that's true. Donation under these circumstances has a bit of a stigma attached to it because of the possibility of disease transmission, although very, very low. And I think dying from an overdose there is some stigma attached to that. So I think one of our goals is to try to get awareness out that, in fact, these donors are really appropriate and can be used very, very successfully and can prolong somebody's life or save somebody's life.
Safety remains a priority. All organs are inspected by doctors before being given to another person. Klassen says the risk of viral transmission is less than 0.1%. Through a tragic epidemic sweeping the country, killing tens of thousands each year, others are ironically being saved. For many families, that gift of life comes as the only comfort after losing someone to addiction.
It is clearly a sad, it's a very tragic situation for a lot of families, for the entire country. But I think if we look at it as, kind of getting a little bit of good out of what is clearly a bad situation.
While there's no question the good a selfless act like becoming an organ donor can bring to others, many are facing that reality at a much younger age than needed to, meaning that the rise in available organs to those in need is sadly only a silver lining in a much larger and growing epidemic.